Living well with coronary heart disease. Important medical disclaimer. All content on this channel is provided for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. This content focuses on lifestyle recommendations, nutrition guidance, physical activity suggestions, and general wellness tips for individuals who have already received medical care and have established diagnoses from qualified healthcare professionals. Please understand, information does not replace professional medical care. Information is not intended for self-diagnosis or self-treatment. All advice is based on generally accepted medical recommendations, but must be adapted to your individual condition. Before applying any advice from our videos, always consult with your treating physician. Obtain approval from healthcare professionals. Continue treatment prescribed by medical facilities. The channel creators assume no responsibility for consequences of using this information independently without proper medical supervision. Coronary heart disease affects millions of people worldwide. It occurs when the blood vessels that supply your heart muscle become narrowed or blocked. While this diagnosis may feel overwhelming, it's important to know that you can take control. Many people with coronary heart disease live full, active lives. The key is making heart-healthy choices every day and working closely with your healthcare team. Remember that small, consistent changes in your daily habits can make a significant difference in your heart health. Lifestyle. Next, let's discuss daily habits that support your heart. Daily routine. Take all prescribed medications at the same time each day. Monitor your blood pressure regularly, if recommended. Maintain a consistent sleep schedule of 7-8 hours nightly. Avoid exposure to secondhand smoke and air pollution when possible. Schedule regular checkups with your healthcare provider. Sleep quality. Create a calm, cool sleeping environment. Avoid caffeine and heavy meals close to bedtime. Turn off electronic devices 1 hour before sleep. Practice relaxation techniques if you have trouble sleeping. Stress management. Identify and limit your stress triggers when possible. Practice time management to avoid feeling overwhelmed. Engage in hobbies and activities you enjoy. Maintain social connections with friends and family. Risk factor control. Stop smoking completely. This is one of the most important steps you can take. Limit alcohol consumption to moderate levels or avoid it entirely. Maintain a healthy weight through diet and exercise. Manage diabetes if you have it by following your treatment plan. Important. Smoking cessation provides immediate and long-term benefits for your heart health. Nutrition. The following part covers heart-healthy eating habits. Heart-healthy eating patterns. Follow a Mediterranean or DASH diet approach. Fill half your plate with vegetables and fruits at each meal. Choose whole grains over refined grains whenever possible. Include lean proteins like fish, poultry, beans, and nuts. Use olive oil as your primary cooking fat. Beneficial foods. Fatty fish like salmon, mackerel, and sardines twice a week. Colorful vegetables and fruits rich in antioxidants. Whole grains including oats, quinoa, and brown rice. Legumes such as beans, lentils, and chickpeas. Nuts and seeds in moderate portions. Low-fat dairy products. Foods to limit or avoid. Processed and packaged foods high in sodium. Red meat and processed meats like bacon and sausage. Foods high in saturated and trans fats. Sugary beverages and desserts. Excessive amounts of salt in cooking and at the table. Specific nutrition tips. Read food labels to check sodium and sugar content. Cook more meals at home to control ingredients. Use herbs and spices instead of salt for flavor. Stay hydrated with water as your main beverage. Remember that what you eat directly affects your heart health and can help prevent future complications. Physical therapy. Moving on to exercise recommendations. Getting started. Begin with 5-10 minutes of light activity if you're new to exercise. Gradually increase duration by 1-5 minutes each session. Aim for 20-30 minutes of continuous activity as your goal. Exercise at least 3 days per week, preferably daily. Recommended activities. Walking at a brisk but comfortable pace, swimming or water aerobics for low-impact exercise, stationary cycling or recumbent bike, light strength training with resistance bands or light weights, yoga or gentle stretching routines, exercise intensity guidelines. You should be able to carry on a conversation while exercising. Rate your effort on a scale of 1-10, aiming for 4-6, moderate intensity. Start 20-30 beats above your resting heart rate. Monitor how you feel and adjust intensity accordingly. Safety restrictions. Stop exercise immediately if you experience chest pain, severe shortness of breath, dizziness, or nausea. Avoid heavy lifting or straining activities initially. Don't exercise outdoors in extreme temperatures. Always warm up before and cool down after exercise. Important: regular physical activity strengthens your heart and improves circulation throughout your body. Hardening. Next, let's discuss conditioning practices. Temperature adaptation. Gradually expose yourself to temperature changes. Dress appropriately for weather conditions. Avoid sudden extreme temperature changes. Take lukewarm showers rather than very hot or cold ones. Fresh air exposure. Spend time outdoors in clean air environments. Take gentle walks in parks or natural settings. Open windows for fresh air circulation when air quality is good. Avoid outdoor activities during high pollution days. Benefits: improved circulation and blood vessel function, enhanced immune system response, better stress tolerance and resilience, improved sleep quality. Precautions: start very gradually with any conditioning practices. Always consult your doctor before beginning new activities. Avoid extreme temperatures or harsh conditions. Stop any activity that causes discomfort or symptoms. Please note, hardening practices should complement, not replace, your medical treatment plan. Breathing exercises. The following section covers beneficial breathing techniques. Deep breathing technique. Sit comfortably with your back straight. Place one hand on your chest, one on your belly. Breathe in slowly through your nose, expanding your belly. Exhale slowly through your mouth, letting your belly fall. Practice for 5-10 minutes daily. 4-7-8 breathing. Inhale through your nose for 4 counts. Hold your breath for 7 counts. Exhale through your mouth for 8 counts. Repeat this cycle 3-4 times. Use this technique when feeling stressed or anxious. When to practice: before meals to aid digestion and relaxation. During stressful moments throughout the day. Before bedtime to promote better sleep. Before and after physical activity. Benefits: reduces stress and anxiety levels. Lowers blood pressure temporarily. Improves oxygen delivery to your heart. Promotes overall relaxation. Important: breathing exercises are simple tools you can use anywhere to support your heart health. Mental aspect. Now, let's address the emotional side of living with heart disease. Stress reduction techniques. Practice meditation or mindfulness for 10-15 minutes daily. Use progressive muscle relaxation to release physical tension. Listen to calming music or nature sounds. Engage in creative activities like art, music, or writing. Psychological support. Don't hesitate to seek counseling or therapy if you feel overwhelmed. Join heart disease support groups in your community or online. Share your feelings with trusted friends and family members. Consider spiritual or religious practices if they bring you comfort. Motivation strategies. Set small, achievable health goals each week. Keep a journal of your progress and successes. Reward yourself for meeting milestones in healthy ways. Focus on what you can do rather than limitations. Remember that every positive choice benefits your heart. Coping with diagnosis. Accept that feeling worried or scared initially is normal. Learn about your condition to reduce fear of the unknown. Focus on the many treatment options available today. Remember that many people with heart disease live long, fulfilling lives. Remember that taking care of your emotional health is just as important as caring for your physical heart. Finally, let's cover additional important aspects of managing coronary heart disease. Medication support. Take all prescribed medications exactly as directed. Never stop or change medications without consulting your doctor. Keep a list of all medications with you at all times. Use pill organizers or phone reminders to stay on schedule. Report any side effects or concerns to your healthcare team promptly. Social support. Educate family members about your condition and treatment plan. Teach loved ones to recognize signs of heart problems. Build a network of people who support your healthy lifestyle changes. Don't isolate yourself. Stay connected with others. Ask for help when you need it with daily tasks or transportation. Health monitoring. Keep track of your blood pressure, weight, and symptoms. Schedule and attend all follow-up appointments. Know the warning signs of heart problems and when to seek help. Carry emergency, contact information, and medical alert identification. Learn CPR basics and encourage family members to do the same. Doctor communication. Prepare questions before medical appointments. Be honest about your symptoms, concerns, and lifestyle challenges. Bring a list of all medications and supplements you take. Ask for clarification if you don't understand something. Discuss any changes in your condition promptly. Preventing complications. Follow all aspects of your treatment plan consistently. Recognize early warning signs of heart attack or worsening symptoms. Maintain regular dental care as gum disease affects heart health. Get recommended vaccinations to prevent infections. Stay informed about your condition through reliable medical sources. Important, early detection and prompt treatment of any changes in your condition can prevent serious complications. Remember that you have the power to positively influence your heart health through daily choices and partnership with your healthcare team. Thank you for watching our video. Please remember that the medical tips and information you just heard are intended for general informational purposes only and are not a substitute for professional diagnosis or treatment. Always consult with your doctor or another qualified healthcare provider before making any changes to your treatment plan or lifestyle. Everyone's health situation is unique, so what works for one person may not be suitable for another. Stay healthy, take care of yourself, and don't forget to like, subscribe, and share if you found this content helpful.